If you're considering starting a Tretinoin program, or if you're already on it for a little while, watch this video because I'm going to tell you how to deal with and lessen the most common side effects of Tretinoin administration. Hi, I'm Dr. Messina. Tretinoin has become the mainstay of my acne practice as well as the cornerstone of my facial rejuvenation program. A vitamin A derivative established in the early 1970s as a topical treatment for acne. However, in a short period of time, it was realized that tretinoin can be used to treat a host of dermatological conditions, such as hyperpigmentation and rosacea. It could also soften acne scars as well as remove the evidence of sun damage. Therefore, it also became the cornerstone of all the facial skin rejuvenation programs. However, it comes with some side effects. For the most part, a dry skin that's very flaky and tender. You might even have an increase in acne outbreaks in the area. If you're using tretinoin for acne, you're probably going to be on the higher strength, and you're going to be told to use it nightly after you've cleansed the skin and added your moisturizer. And you'll most likely notice after about 2 weeks or so that your skin is looking worse. It might be dry and flaky. It could be red. You might have a few more pimples than you did when you first started. Some people say it even feels warm and tender to the touch. Well, the good news is that's all related to how tretinoin works. Tretinoin increases the cellular turnover in the skin. Now, in a young, healthy skin, the cells turn over about every 28 days. However, a middle-aged patient might turn them over at about 50 days. Well, the tretinoin increases that cellular turnover, which causes a sloughing of that outer dead keratinized layer of skin. That does a few things. It makes us more prone to water loss, and it also allows toxins and irritants to get into the deeper level of the skin easier, because that keratinized layer works very similar to the crust seen on the surface of the desert sand, protecting life and vegetation below. The good news is that your skin will become accustomed to this higher level of cellular turnover in about 3 to 4 weeks. So there are things you could do to make it more tolerable during this high level of turnover. We also have something called purging, which is a significantly stronger irritation where you could get a preponderance of acne outbreaks in the same area that you've already developed your acne. A few take-home points. If you're having just the routine dryness, itching, and flaking, then just by using your moisturizers, you should get through it in about 3 to 4 weeks. Purging, just like the other side effects, is also self-limited and will resolve in somewhere between 6 and 8 weeks. Now, if you look at the internet, you're going to see people saying, I've been purging for 2 months, 3 months, 6 months. That's probably not purging. They probably have some extraneous factor causing a chronic inflammation. And we're going to discuss that in a moment. So who is susceptible to these side effects? Well, people that are very fair-skinned, who don't tan and instead burn in the sun, are more susceptible to getting dryness and flakiness with the tretinoin administration. Also, people who have dermatological conditions such as eczema, atopic dermatitis, or rosacea. People who have dermatovascular abnormalities, who flush very easily, or if you flush while drinking wine or vasodilate very easily, are more susceptible to these side effects. And conversely, darker-skinned individuals with larger pores and more sebaceous output, in other words, an oily skin, tend to tolerate tretinoin better than these other individuals. And then we have the people who adhere to a very broad spectrum of daily skincare treatments, starting with the cleanser, and then adding a toner, an exfoliator, a vitamin C derivative, your tretinoin, and your sunblock. That's all well and good under normal conditions, but when you add tretinoin, especially in the early phases, until you get the retinization of the skin, you're going to be extremely sensitive. Remember, we've lost that keratinized layer. So these topical agents are going to have a more profound effect. I tell my patients it's always good to kiss. Keep it safe and simple. Start with a cleanser that's very gentle. A cleanser that lacks alcohol or fragrances or any type of exfoliant such as salicylic acid. And wash your face once, maybe twice a day. Add a moisturizer. I like CeraVe, I like Noxzema if you could find it. All of these moisturizers that are just pure moisturizers. They don't have antioxidants in them, they don't have any alcohol in them. And moisturize and let it dry before adding your Tretinoin. Then you could moisturize again. And in these early phases of Tretinoin administration, I never recommend my patients to go and use the top shelf cosmeceuticals. They tend to have too many extraneous substances in there. Of course, they want you to get the best result. So you might find that they have an exfoliant in there, vitamin C, antioxidant, all these things that are wonderful in normal times, but really not appropriate during the times when you're just starting Tretinoin. It can actually hurt your outcome and make things worse for you. Let's talk about purging. If you should be purging, it's going to require a little finesse on your part. You're going to have to use a gentle cleanser and a pure moisturizer. There's going to be no face masks, no loofering, no chemical peels, not even weak alpha acid peels. You're not going to want to put any type of abrasive on the skin or alcohol. And you should get through that purge in about 6 to 8 weeks. However, if you look on YouTube, you're going to find a host of videos where people are saying, I've been purging for 3 months, 4 months, 6 months, a year. Well, they're probably no longer purging. They're probably having excessive irritation. So if you go beyond that 8-week mark and you're still purging, there are a few things you should look into. First, see if you're adding some extraneous product that could be causing irritation, like we just discussed. And if you find you're not using all these other products and it doesn't seem to be an extraneous outside force causing the increased irritation, we could change the product. You might go to a lower strength of Tretinoin. Or you might switch for a short period of time to every other night and then work back up to every night. You could also look at the vehicle. For instance, if you're using a Tretinoin gel, it might be too drying for you, especially if you have dry skin and live in an arid climate. Well, then the cream might help. So you can switch to that formulation, carrying it in that vehicle. And those are the fundamental reasons as to why some people get excessively dry skin and purge very strongly after administration of Tretinoin. People just don't respect the potency that transdermal drugs can have because you're putting it on the skin. But they do get absorbed and they can have powerful effects. I hope this answered all your questions. If I didn't, remember my comment section is always open. So you could ask me questions on that and I'll surely answer you. I hope you enjoyed this video, and I have a few more videos that you might like regarding skincare and the retinoids. Take care and have a great day.